Welcome to Wellness Warriors, a podcast addressing the root causes of illness and their natural solutions. And now your hosts of Wellness Warriors, Dr. Justin Lane and Michele Schroeder.
Well, hello, Dr. Justin Lane and the lovely and delightful Michele Schroeder. How are you doing today?
Good.
It's so good to see all you guys. Everybody doing well?
Very well.
Absolutely.
How are your teeth today? Because we happen to have a special guest who just happens to be a dentist.
Yep.
His name is Dr. Matthew Geddes, and he's from right here in St. George, Utah. What's the name of your practice again?
Gateway Oral Health Center.
Gateway Oral Health Center. Where's it located in St. George?
River Run Road, just across from Harmon's, across from kitty quarter from the hospital.
Oh, yes. Yeah. We'll all have to go over there one of these days and have to go at Harmon's and go shopping and then go get our teeth fixed. Oh, you know, Michele, you and I were talking earlier. I know you have a lot of your clients. We're talking about some illnesses and stuff that just keep dragging on and on and on. And you have advised them, you know, maybe you should check and make sure your oral health is also in order. Am I correct in that?
Absolutely.
So tell me a little bit more about that.
Yeah. So one of the triggers of autoimmune disease and other chronic illness is infections that are sometimes hidden and they don't really realize that they have them. And also toxins, such as things like mercury and things like that. And so when we're dealing with taking a look at all of the factors that could be contributing to the disease, you can't ignore your oral health. And that's why I really wanted to invite Dr. Geddes today, because he probably has a lot of answers and explanations I don't know how to give my clients. So,
well, shall we ask him a question?
Absolutely.
I have one right here I can
Go
ask
for
him.
it.
Unless you.
Yeah.
So one of the questions that we want to ask you is, why is oral health so fundamental to the overall health of the entire body?
In the mouth, there could be hidden infections, metals, like Michele just stated, that affect the overall health. Root canal teeth are big contributors. They block energy meridians, and they are a source of autoimmune issues for the body: bacteria, fungal, parasites, you name it.
So we should not get root canals.
I don't recommend it.
That's okay. You can say that here. It's all right.
I don't recommend it.
Yeah.
If you want some health issues, sure.
You know, I would prefer to do without the health issues. I was telling you earlier that my niece does exactly what you do. Her name is Dr. Lisa Butler, and she's located in Dana Point, California. And I remember one time I was having some health issues, and the dentist said, "Oh, you need a root canal." And so my wife called Lisa, and Lisa goes, "Oh, no, bring him down here right now." So we made a trip down to California, and she took good care of me. So I'm hearing more and more about those types of issues that people are having with their teeth from standard dentists, and what we all kind of grew up with and have lived with. Oh, when you have the problem, you get a root canal, but obviously now times are changing.
Which begs the question, actually, because just to give our listeners and viewers some context, biologic dentistry is sort of a new concept for some folks as compared to traditional dentists. So I think a lot of people really don't know the difference. So could you talk about that a little bit in terms of how you differ from a traditional dentist and the types of approaches you take, how you look at the body, and how you do things differently?
Yeah, thank you, Justin. So for biological dentists, our philosophy is we want to clean the mouth get rid of metals in the mouth, root canal teeth, and infections. So a lot of time there's a lot of inflammatory markers. People can't find out what's causing it. They can be in the mouth due to those things, and they block the energy meridians. So we want to get the metals out, get the root canal teeth out, and clean up the infections. Now, what do we do when we take out the teeth or that? So we use ceramic implants, and that's the big thing. We take out titanium implants, replace those ceramic implants. So that's kind of our main things. And then from there, we just want to look at the root cause of, hey, why is this going on? Why are you getting cavities?
Okay, so I have a question. So I recently had an implant, and they used a metal post in there. Are you telling me I got to go back and have them rip out the metal post and put something else in there that's not metal, a ceramic post or something?
I'm not a fan of the titanium implants, the metal posts. They cause a lot of inflammation in the body. There's a lot more research now, just even the last year, just how it interacts with the body. Just the titanium. It's not just titanium. It's multiple metals in the titanium implant. So I'd recommend getting that out of there.
Great. So I feel really good about myself now.
Well, I have a question for you. In what ways does it interfere with the body? Like, I heard that if you have like a metal post, that even the EMFs that you're exposed to can interact with it in some way. Can you tell me a little bit more about that? Like,
Yes, I mentioned EMFs. Just with the metal, just with the cell phones and the 5G towers, it heats up the bone like 5 degrees. So it's like a little antennas in our mouths, in our jaws. So there's a thing called oral galvanism. So that just attracts bacteria, inflammation around these metal fillings, metal implants, metal crowns. So a lot of crowns have the metal underneath the porcelain. We call those porcelain fused to metal crowns. So a lot of people think, oh, I have porcelain crowns, but they may have metal underneath those and they don't know it.
So even gold would be ungood?
Yeah, because gold is 5 or 6 different metals mixed with the gold.
Great.
yeah, I'm in the process of getting all that done now. So
Oh my,
yeah,
really?
yeah.
Are you having a good time doing that? 'Cause,
It's not fun, but
'cause
it's
we all-
worth it.
we all enjoy going to the dentist. I have it on my schedule. Be sure and go to the dentist. It's so much fun.
Yeah, I have another question. You're talking about root canals. Can you explain a little bit more about how infections lurk in there? Like, is it with, like, you might not know you have it, so is it, I know there's cavitations, but can you explain a little bit about that?
Yeah, so with root canal teeth, most often you get a root canal tooth because you have an infection or an abscess tooth. So the infection's already there. They clean out the inside of the tooth, the main canal. They try to get the other canals, but there's hundreds and can be thousands of accessory canals that have to be cleaned out. If those don't get cleaned out all the way, then you have this bacteria that harbors in there, anaerobic bacteria just flourish because there's no blood supply, there's no nerve supply. So you have this dead organ left in your mouth. We're the only profession that leaves dead organs in the body. If someone's appendix bursts, well, they don't just leave the appendix in there, they take it out.
Right. Can you talk a little bit about fluoride? Because we've we've been propagandized for a long time about the benefits of fluoride, and there's plenty of research that goes both ways with that. What are your thoughts on using fluoride and how that compares maybe to traditional dentistry?
I used fluoride for a long time and I was a traditional dentist. Now, knowing what I know now, it's toxic. It's a neurotoxin, and so I don't recommend it. Stay away from it. I mean, even on the toothpaste, you look at it, and it says, do not, ingest
Right.
the toothpaste. And
Keep it away from children.
Yeah.
Yeah.
So that right there is, a big no-no. I used to do fluoride treatments, and I remember one patient where a young teenager threw up and got really sick afterwards, and that was my the mom told me, hey, this isn't good. And that's when she helped me look into it, and I realized, I'm just giving poison to my patients.
Yeah, tell us more about what brought you to holistic dentistry instead of the traditional. I'm curious, what made you make that switch?
Well, I had several patients like that with fluoride. They wanted to put fluoride in our town water, and there was a lady that fought it, and I thought that was just crazy. And then I got my first 3D x-ray machine, a cone beam. I started seeing all these infections around root canal teeth. And I say, hey, how long have you had this root canal tooth? Oh, 20 years, 15 years. It's always felt like this. Something's always, feels weird, but that's just, they say it's normal. Well, that's the body saying, hey, something's wrong. There's inflammation on that tooth. And so that was a big one for me, is seeing all these infections around root canal teeth when we're taught, hey, the infection goes away, when in reality, majority of them do not. And the ones that actually look okay on the x-rays, we'll take them out. People that want them taken out, we'll send them to a pathology lab. They come back with all sorts of fun stuff. E. coli, bacteria, fungal, parasites. We even found Lyme disease recently.
Oh my God.
Oh, wow. So it's one of the sources of some of these hidden infections that Dr. Lane tests for all the time.
Yes.
Yeah. Yeah.
Yeah. It's
So-
fascinating.
So
Yeah.
could that be a cause of some things like brain fog, and I'm tired all the time, and I just get these autoimmune flare-ups? Could that be a contributing factor?
Definitely. That's one thing we we talk a lot about is, and we run labs for it, but we often say, hey, that looks like based on blood work, you have a chronic infection. When have you been to the dentist last? Because most people don't think of their mouth as a source. And so we've sent a lot of people your way because we're like, listen, there's certain bacteria that we're testing for that indicate it's oral bacteria. And so we need to get that cleaned out so your body can function, optimally. Can you talk a little bit about, and this is something that I don't know if the average person knows when they go to a dentist's office, but the upgrade in technology, what we have now, you alluded to it with a 3D cone beam. My understanding is that catches a third of all infections that weren't previously caught with the bite x-rays. Is that accurate? And what are you seeing now clinically I imagine you used to use the 2-wing bite compared to the 3D cone beam. These are diagnostic x-rays essentially that are usually done, I imagine, on a first or second visit, so you get a sense for what's going on. But a lot of people don't know the difference between that or even know to ask that. So I'm just curious if you could just talk a little bit about what you see clinically.
Yeah, so I can't work without a 3D x-ray machine now. So 3D x-ray.
It's just a standard.
Yeah, cone beam. It's like an MRI machine at the hospital, but way less radiation. So that's, we still do the 2D x-rays, check for cavities, but with the 3D x-ray we can see so much more. It's like looking at the ocean, but then once you put your head in there and snorkel, you can see all the fish. So I mean, too bad we can't show some pictures. We can show like 2D x-ray and a 3D and just see the difference. In 2D it's, there's might be something there. Look at the 3D x-ray and there's huge infection in the mouth.
Oh, maybe next time if we have them back, we should do that. We could show them right there on the screen. That'd be cool.
Yeah, in fact, I would just encourage our listeners to ask if for a 3D cone beam x-ray, if they're making a dental appointment. If they don't have one, you might think twice about going there.
Yeah, and also I think there's different ways of reading these x-rays from my understanding, and I believe you have some pretty good software that helps you even know more about what's going on than maybe just some dentist that has a cone beam x-ray. So tell us about that software too.
Yeah, so a lot of dentists are not looking for what we call cavitations. That's the infection in the jawbones that you mentioned. So you want to find someone that can look for those as well. The orthopedic doctors, they recognize that cavitations is a health issue, but in dentistry we kind of haven't been taught that. We just kind of ignore it. So we want to have a cone beam that allows us to look at the bone density in the jaw to find those cavitations, which are those cavitations are the infections in the jawbones. And those that have a high concentration of the RANTI, CCL5 proteins, inflammatory proteins. So those can be, issues with autoimmune issues.
Do those show up on that, what's it called, a cone beam? Those will show up in a cone beam x-ray, whereas the 2-wing bite down, choke to death stuff.
I remember.
Yeah.
You have to have a cone beam with 3D x-ray to see those. And there are a couple machines that you can't see them. They don't have the software for them. So those Sirona, Galileos, and another one, but they're they're proprietary software. Most other cone beams that can be shared to other dentists with STL files, those generally you can, but the Galileos and the Sirona don't have those.
So the cone beam, do you stick something in my mouth like that?
No.
I just sit there and look adorable, and all of a sudden I get zapped.
Even more adorable, you mean?
And you go, there you go, Mike. You're a mess. Wow, that's great. I would go there just for that because I hate those 2-wing bite down things, and I'm like gagging, and the dental assistants
Those
going,
are
just breathe.
those are still important to check for cavities.
Oh my gosh.
But if you want to check for these hidden infections that are in the mouth, if anyone has a root canal, go get it checked. 'Cause you'll be surprised how many infections are around root canal teeth, and even the ones that look pretty decent. Whenever we take those out, people want them out. We always find something. and just the stories afterwards, it's amazing. Even just removing the metal from the mouth, what that does for people. I mean, the energy meridians,
So interesting about pulling metals out, and I talked to my wife about this. We were very careful about that because we wanted to protect her barrier system. We have a blood-brain barrier and a gut barrier, and I've seen a lot of clients in my career who've gone to detox clinics, and they're doing these heavy chelations, and they're pulling metals out of your tissue, but they're depositing them in the brain and in the gut and the liver, and that can really cause a lot of problems. So I would just add, at least what I recommend to my clients, for sure when they come to you, if they're pulling metal out, we want to make sure the brain's protected and the gut's protected. So because we don't know always where that metal's gonna go, right? Some of that metal is pretty toxic, and it's in very small quantities. So does it travel when you're pulling it out of teeth or tissue, or is it contained? Or talk a little bit more about what do you do with the metal? People might want to know, like, where are you putting the metal when you take it out? Where does it go? What do you do with it?
Yeah, so first we're going to gown the person up, take some binders. We're going to use a rubber dam, so that way the metal's not going down the mouth. Use a lot of water, so there's going to be some aerosol coming out, so use lots of water. We have a big vacuum, about this big, right next to the mouth also, along with our other suctioning. And so we have an oxygen mask on their nose, so we don't want them to breathe any of this in. We wear carbon masks, charcoal masks, and so we're gowned up as well. So we just want to contain everything, and we suck it up. And
kind of like a hazmat suit if you're doing mold remediation. Yeah, that's good.
Yeah,
that's good.
No, we worked on a client who was a functional medicine doctor, and person came in and said, "I'm doing a metal detox, but I'm starting to taste all the metal that's in my mouth. I better get the metal out first before I continue." I was like, so.
Yeah, I've heard if you do a metal detox without removing the metal out of your mouth, you can do it for a brief time, but after that you'll start to pull the mercury or whatever from your teeth if you're doing metal detox. Yeah.
Okay, what's a metal detox? You guys have to clue me in on that one.
So metal, basically you're moving metal out of the tissue is what you're trying to do, is trying to bind it and then typically chelate it out of the body, because metals don't generally detox through the liver. A lot of our detox is through the liver or the kidneys. Metals are a little special. They need a chelation or a binder to help them exit the body. Yeah,
they need both.
Safely. So, so there's a lot of reasons people do metal detoxes. A common one in our world is it's a trigger for autoimmune disease. So it's not necessarily the amount. There's a different model for metals. There's a quantity model. So if we did a blood test, we'd all probably have high quantities of something because we've been living long enough. The real question for us, though, is what I have in my body reacting with my immune system? And so that's where the issue comes. If you're actively reacting to the metals in your body, then it's a trigger, and we want to remove it safely so that the immune system can recover and calm down.
Oh, okay. So does that only apply to metals in my mouth? What if I have metal pins in my arm, on my leg or something? Do we have to take those out too?
Well, that's kind of a case-by-case situation. There's some that say, hey, let sleeping dogs lie. If it's inert, meaning we don't have evidence that it's actively riling your immune system up, sometimes we leave it alone because just the process of chelation can flare you up, particularly with autoimmune disease. So it depends is the answer. If we're having an active reaction or an infection, then we start to consider it to remove it because it's an issue.
So, doctor, what are some things that we, meaning anybody, can do right now to help protect their dental health, their hygiene, which will help to protect their overall health and wellness? What are some things we can do right now?
Brush and floss, the teeth that you want to keep. You only have to brush and floss the
just
teeth
the ones you want to keep.
Right. Yeah, I never did like this one. I'm not going to brush it. Okay, so brush and floss, the ones we want to keep.
You want to have a good diet also. If your having stomach issues, and see someone like Justin, that can help with the gut, because the gut's
great bad. To hear a dentist say this, by the way.
If the gut's bad, you're gonna have a low pH, acidic mouth, and then you're gonna be fighting cavities.
Yep.
So you want to get that in balance. Otherwise, you're just gonna be going to the dentist over and over and over.
Yeah.
And that's no fun for anybody.
So that goes back to one of our earlier podcast we did about food as medicine,
Mhm.
which I would urge you all to go back and check that out because it's all archived. But
Mm-hmm.
that's a really good point, and you're right, Justin. I've never heard any dentist say that. Oh, just have a good diet.
Yeah. Well, we know in Chinese medicine we call it stomach heat. So people that have bad breath or get hungry very quickly, they're inflamed. Usually their metabolism's high, but it comes out in the breath. So you know the bacteria are there probably from the breath odor and some of those symptoms. But you often see the inflammation, I imagine, in the gums and the mouth. So yeah, it starts further downstream, if you will, or upstream and then downstream and then back upstream. So,
So what should someone look for when they're looking to find a good holistic dentist, someone such as yourself, other than just call you and go visit you at your office? But if someone's in Massachusetts and they can't make it here right now, what should they look for?
And can I add to that question?
yes,
I want to
please.
add one thing to that question. So let's just say that somebody knows that they have at least a mouth infection that showed up with bite wings, and I'm working with them, and I know that they have a hidden infection. Maybe they've been tested with Dr. Lane, and we know they have white blood counts that are off, and there's something hidden, and we know there's something going on in the mouth. What's the first thing you would do, and what should they look for to get the right dentist?
Yeah.
They have to have a cone beam, a 3D X-ray machine, and they got to be familiar with cavitations, how to find them, how to recognize them, and how to treat them. There's some that have a 3D X-ray, but they don't know much about cavitations, whether how to find them and what to do with them. That'd be someone to still see, but you don't want to miss those cavitations. Most common area for cavitations are where any tooth has been taken out. Most common is wisdom teeth.
Wisdom tooth.
So, but at least have someone with a 3D X-ray machine. You want someone who uses ozone, laser if possible, and does PRF. That's a platelet-rich fibrin. Draw your blood, spin it. and
PRP
take-
for the mouth.
Yeah.
Okay.
Just without all the additives, though.
Right.
So
Okay.
it's just pure
Wow.
patient's blood, white blood cells and platelets mixed out with bone graft. Lots of sorts of things we can do with it.
And that fills up the cavitation so that you don't still have one there after it's all cleaned out. You put the bone graft in, and then
Yeah.
you don't have it still lurking with bugs and yucky stuff.
Yeah, so
My
we'll
scientific words.
I like you have yucky stuff.
it is. Yeah, so we'll fill it, the cavitation, the hole that we cleaned out in the jawbone, fill it with a bone mineral graft with PRF also combined. So it's not just this big empty hole that has to hopefully fill in, because our mouth is so dirty. We can't have a surgical site with iodine and sterile because the mouth's so dirty. So we do our best, and then the PRF is going to help fight the infections as it heals, helps with the healing. So, yeah. So anytime we take out a tooth, we treat it like a cavitation. We're using ozone, we're using laser, we're using PRF, we're using piezo, nano silver. So we use it all.
Sign me up.
And
PR
do other
go ahead.
dentists do that when they take out a tooth? Do they go to that much? Do they do that, or do they just do a
Most-
basic wash?
Basic wash. Some oral surgeons are now placing PRF in the wisdom teeth sites, which is better than nothing. But we used to do that, but we've seen better results. Not having recurrent cavitations, just with mixing with the bone graft.
Yeah.
So some would say, "Oh, PRF's enough on those." So we've done both, and we're getting good results mixing it with the bone graft.
Could you talk a little about when you mentioned brushing and flossing is basically maintenance care? So do you recommend certain types of toothpaste? What are your thoughts on activated charcoal, for example, toothpaste, or other toothpaste that or certain mouthwashes like hydrogen peroxide or other? Can you talk a little bit about specifically, rather than the traditional toothpaste with all that garbage in there? Can you talk about what you might recommend in that world with brushing and flossing too? Is there a certain type of floss, waxed, unwaxed? Do you see is there a big difference between? I always wonder about that myself. So
Find a toothpaste that you like first that's non-fluoride, and to find one that doesn't have all the other
Toxins.
toxins in it. Sodium lauryl sulfate, titanium dioxide. There's so many toothpastes that non-fluoride that still have those in them. So that'd be the first thing. Find one that you like and then will use. Because if you don't like it, you're not going to use it. Floss, any floss is good. I like this silk floss from Dr. Geddes. It's a little more expensive, but it's really nice. But a good floss, I like Johnson & Johnson. That's good one. Some people will say, hey, but find one that you'll use and you like. A water pick is good too. You can put some nano silver in there, peroxide in there. So,
are there mouthwashes that you would recommend too? Specific types or?
There's some with hydroxyapatite are good. Nano silver is good. Stay away from the ones with alcohol. There's no benefit in those. Just stay away from the ones with alcohol.
No more scope.
Yeah, no more scope. No more. Wait, did you know what scope was used for back in the day? Well, Listerine, I guess. It used to be a toilet bowl cleaner.
Oh my gosh!
Way back in the day.
Tastes like it. Yeah. Not that I taste toilet bowl cleaner often, but yeah, it's pretty rough.
So nothing with alcohol. No more Dr. James Beam. Right. Okay, just the stuff you recommend. Okay, so that's cool.
There's Just Ingredients. That's a good one. Boca has some stuff. We have some nano silvers. Those are good.
There used to be
colloidal silver.
Colloidal silver, yeah. I'm partial to activated charcoal, but they used to have the real nitty-gritty stuff. It's harder to find now. It used to be much messier, and now I think they're starting to cut it with some other chemicals. So you have to kind of watch out for the quality on those, I think.
Bentonite clay. You can make your own toothpaste at home. Bentonite clay. Put some
nice
different essential oils in there. So there's some stuff you can make at home too that's really good.
That's cool.
All our doTERRA listeners out there, you have all the essential oils now, so you can start using them.
So before we go, if someone would like to contact you to make an appointment, primarily to see your really cool 3D cone machine, I may go just to see that. That sounds cool. So how can someone get a hold of you?
Yeah, you can Google Gateway Dental, and website will pop up. You can call us. So we're just down here in St. George, Utah. Phone numbers.
That's right.
It's on the website, so I do it all the time.
It's got numbers in it. You'll recognize it right away.
Is a consultation usually the first step? Is there a fee for your consultation? Is it complimentary? How does that work?
Yeah, so the first appointment, we'll do a full exam. We'll take a 3D x-ray, all the x-rays, and we'll just look over and whatever we find, we'll go over it with you and say, hey, this is what our recommendations, and then we'll just ask, what do you want to do? So its first exam, I think, is $200. That includes a cone beam, 3D x-ray, and all the x-rays in the exam, which, I mean, where can you go for a 3D x-ray?
And by the way,
pretty fair.
I have research these prices for holistic dentists over the nation, as I've had different clients in different states.
She's got lots of time.
And that's a good price.
Maybe it's $250, but it's
anything under $300. That's a good price.
That is good. I would go just for the cone beam. So
not the gym beam, the cone beam.
The cone beam, not the gym beam. That'll work. Well, thank you so much for joining us here today. I'm glad that you showed up, provided a lot of great health and wellness information about my teeth. I'm terrified to now eat anything or kiss anyone. So, but Justin and Michele, you guys are great, and we're going to see you guys all again next time with another exciting episode of The Wellness Warriors. Take care.
This has been Wellness Warriors, giving people the knowledge to have a healthy and vibrant life. For more information, elementalnaturalmedicine.com and KMichelleSchroeder.com. We invite you to join us next time for another edition of Wellness Warriors.